Welcome back. Today we are going to ask Colleen, how does a person know that they are an addict?
Well, that's a great question. I think a lot of people have that question. I think we either spend a fair bit of time trying to explain why we're not, or to figure out if we are. And so, how do I know if I'm an addict? I think of it slightly differently. I think, how do I know if I have a problem, right? And probably if we're saying, do I have a problem, there's a problem.
There might be one.
Yeah. And so it's, how do we gauge what a problem is? Well, if a spouse or a loved one is upset with our use and frustrated with our use, there's a problem there. Now, that problem doesn't necessarily have to reflect a unhealthy relationship with a substance. It could reflect that, somebody in the relationship, has a view and expectation in it that there shouldn't be this drinking or, whatever's involved, right? But usually if that's presenting itself, it's at least worth the question, right? Of finding out. And so I think it's sitting down with somebody, sitting down with a therapist and just asking, like, this is my behavior, this is what I do, what's going on here? And I think if you're sitting down, with a good, honest therapist, they're going to be able to say, like, I'm not sure that sounds like a problem, or, well, there are some problem pieces to this, right? So with myself, I know I just sit down and I listen, and what I try to hear is, where is it becoming difficult? Like, is it difficult to explain to a boss or a supervisor? Yeah. Is it difficult to hide it from people? Is it difficult to tell your spouse you're at the bar, or, a variety of different circumstances? And so I don't focus on it so much of whether somebody's in or out of a category of addiction or alcoholism, so much as I do try to figure out, is there a problem? And then we have to address the problem. And there are a variety of responses to the problem of substance use.
Right. So. In Colorado, in particular, substance abuse is actually like a rising problem, not just with alcohol, but with opioids and all sorts of issues. But a lot of people don't seek any sort of support for that because they feel like there aren't resources there, or they're afraid to say anything, or they're worried they won't be able to afford it.
Right.
So what have you seen as far as, like, resources out there for people who are coming to the conclusion that, like, I need to get some help?
Yeah, well, I think when we look out in the community, I think we have a number of therapists that have a great deal of experience with addictions. I think there are some organizations, depending on sometimes a person's profession, that will help get involved and kind of lead the way on getting help around addictions. And I know here at Therapy Matters, what we offer is sliding scale therapy with a variety of therapists with different experience levels around addiction. We offer an opiate support group, like an opiate abuse support group, for folks that are struggling with that issue in particular, because there's a very different experience with coming off of opiates, in terms of, like, chronic pain and the reasons why we went on the opiates in the first place, the fears around that. I think there's a lot of people that are just terrified that they're just going to have to live in pain for the rest of their lives.
Yeah.
And, I've dedicated a great deal of my time focusing on alternatives to pain medications. And I know sometimes people are afraid, well, that's going to be like bringing a knife to a gunfight. But interestingly enough, I have I would say a significant portion of my caseload is opiate addiction, and those folks don't live in pain. I don't have any clients living in pain.
That's exciting.
They're not on opiate pain medication.
Wow.
Yeah, and so there really are some things working out there, and we can get into the physiological, psychological link between pain and I just think there's a number of resources out there for folks, and it doesn't have to mean black or white for people.
Right.
Being free from an opiate addiction doesn't mean living in pain at all.
Right.
I think that does absolutely get moderated. And as well with any other substance use disorders, we have a variety of therapists that can work with all of those issues in terms of triggers and cravings. And in fact, EMDR can be really powerful with desensitizing cravings, so we don't feel as drawn to going out. We address the underlying issues in substance abuse. I mean, usually there's a need to use a substance, and that need to use a substance is that need doesn't go away once we take the substance away.
Right.
Yeah. And so we need to meet that need. And so it's really important to move in and directly find where is that need coming from and what does it actually need. It's more general.
Replace it instead of just going cold turkey, taking it away.
Yeah, no, nobody's going to do well with that. Like, it obviously came in for a very good reason, the use in the first place, and we're not getting anywhere if we don't find out what that is.
Well, we have a number of resources, like she said, sliding scale. There's also a lot of free resources, so be sure to take a look at our events page, and we will see you back for more questions with Colleen.